Hi there, it's Mike Riley here with you again, and it's January, and I'm working with clients right now who are wanting to get their financial house in order. It's very common as part of New Year's resolutions to say, I want to get healthy and I want to take care of all of my money. And one of the most important, if not the most important thing that you can do to set yourself up for financial success is to take care of a will, a power of attorney, and a health directive. Why is this important? Because these are documents that will speak for you if you can't speak for yourself. Now, a lot of my clients are either young single people or young families. And for many of them, it's one of the things that they think about least. They've got lots of time ahead. They're never going to die. They're never going to get sick. Uh, and so, why should they take the time to do this? Especially if they don't have a lot of stuff. And I hear that all the time. Well, I don't own anything, so what's the point? The point is that if you die or if you become incapacitated and can't speak for yourself, somebody else has to make decisions about that. And unless you're a really unkind person, most people want to make sure that the people that are left behind or are taking care of them can do so without a lot of stress. If you've ever had anybody in your life die, you know how stressful that can be, or to take care of someone who has not made their wishes clear. So take a little bit of time and put your thoughts down on paper. I do have a one-page will, uh, power of attorney, and health directive that I can make available to you, and at least it helps guide you through that and put it down. But let's talk about the three things, what they are, and why this is important. So a will. Well, a will is also known as your last testament. That's something that speaks for your final wishes upon death. So if you die, you want to be able to tell somebody what you want done with your body, and if you have anything that's important to you, what you'd like to have done with that. So if you have a motorcycle that you wanted to give to your brother, you can set that down on a piece of paper and say that you wanted to donate your motorcycle. I have a client who has a decent savings plan, and if they die, they want that money to go to a sibling to help pay for school. But without that being clearly written down, it's just my word that this person told me this, and someone may say that something else should happen with the money. So it really doesn't. There's no harm in taking some time and writing down what you want done with any of the assets that you have, any bank accounts, any things that are special to you. The second, and really for a lot of young people, the next two are the ones that are most important because you didn't die, but now you're no longer able to make decisions for your finances or your health care. So the power of attorney, that one is financial. So that is who's going to have the authority to manage your bank account, to make bill payments, to make sure that your rent is paid, your car loans are up to date, or if something significant has to be done for your finances, that this person is authorized to make those decisions for you. As I said on my one-page will and power of attorney sample, you can actually put on this bank account at this institution. You can put the passwords on there if somebody needs to know that, and any other assets that you may have if you have investments or other types of savings. So that's one for money. The health directive is just as it says, being someone that can make decisions for your health. So imagine that you've been injured in an automobile accident and you're in the hospital and you are unconscious. You're not in a position to be able to say, well, I don't want heroic decisions made to keep me alive, or I do. Without having that written down on something that's been witnessed, then it's very difficult for anybody that's there trying to represent your wishes to make those decisions. And I will tell you, it is not as simple as it seems. Many people think, well, my parents will just take care of that. Maybe they will, and it's always best to have that conversation. But if you are in a common law relationship, maybe it's a relatively new common law relationship with a partner that your parents do not approve of, or a lifestyle relationship, etc., that they don't approve of, you're putting the other person, your partner, at some level of distress, if they've gone to the hospital to try and speak on your behalf, and a parent who does not like them or approve of them tries to get interfere and butt in. So if you have that written down and it's been recognized and witnessed, then it takes some real stress off of people. So yeah, this January, take some time. I know it's not a fun conversation to have. Nobody really likes to think about what happens if they die or if they become sick or injured. But I guarantee if you do it this one time, you won't have to think about it again, at least for a while until your circumstances change significantly. So, if you'd like to get information about this, if you'd like to get a copy of my one pager, send me an email. The contact information is just down below to get a hold of me, and I'd be happy to shoot that over to you. So, and Mike Riley, happy 2019. Let's start the year out by getting some of the hard work done and enjoying the rest of the year.